Hello, good afternoon, and namaste. I hope you're all staying safe, observing all the COVID-19 precautions. I'm Dr. Srinidhi Chidambaram, and I'm delighted to welcome you to the COVID Care series presented by Apollo Hospitals. Every day, we bring you awareness and practical suggestions and advice on COVID-19 from our top specialists across our hospitals in the country. Pregnancy is one of the most beautiful and cherished moments in a woman's life, and it is a time of dreams, hope, and tranquility. Except that during the era of COVID-19, tranquility is often the last thing on most people's minds. Pregnant women are even more worried about getting infected and also about the baby being affected. They're afraid of stepping out, and the confinement is oppressive. They can't go shop for the baby because shops are closed. The whole journey towards motherhood is filled with stress and dread. Hundreds of questions are there. How will I go for my checkup? Will the lockdown make it difficult to reach the hospital for my delivery? How will I deliver safely if I get COVID? And what will happen if someone at home is infected, etc., etc. But mothers-to-be do not panic. And one good way of staying calm is to understand the effects of COVID-19 and pregnancy and what to do to stay healthy during these challenging times. To give us her valuable insights, I'm delighted to welcome Dr. Rooma Sinha, Senior Obstetrician and Gynecologist from Apollo Hospitals, Jubilee Hills, Hyderabad. With over 25 years of experience, she is Senior Consultant Gynecologist, laparoscopic and robotic surgeon, and India's most experienced robotic surgeon in gynecology. She is also an honorary professor, Apollo Hospitals Education and Research Foundation, a conjoint associate professor, the Macquarie University, Sydney, Australia, distinguished clinician, Apollo Hospitals. She's a visiting professor at AIIMS Rishikesh, mentor for several fellowships, including the Endoscopy Fellowship, the Vatikuti Fellowship for Robotic Surgery, and many more. Dr. Rooma Sinha has a flair for complex gynecological surgeries and has a reputation and excellence for performing complex surgeries. The FIGO Fellowship in Laparoscopy from the University of Rochester, USA, and the Urogynecology Fellowship at Mercy Hospital, Melbourne, Australia, gave her the international perspectives. Pioneered robotic surgery in India since 2012 and has done the maximum number of robotic myomectomies among other robotic surgeries. She's published over 40 papers and chapters in books and several national and international journals, edited 2 books on fibroid uterus, has the distinction of being invited as a lecturer to several parts of India and the world, and is very experienced in treating women with endometriosis and fibroids that cause chronic pain and infertility. But what makes Dr. Rooma go on is the smiles on the face of the women that she treats. Her ability to inspire confidence in women during their difficult times may be just what we all need. Dr. Rooma Sinha, welcome to our COVID Care series, and I can't think of a better guide and mentor to our expecting mothers at this very challenging time. We look forward to an overview from you on pregnancy and COVID-19, after which we will take up questions. Over to you.
Namaste. Thank you, Dr. Srinidhi, for your really kind words. I'm not sure whether I needed those words, but we will try and do justice to all those women who have joined us today. So welcome you all today for joining on this Apollo Hospital series on COVID. Series where we try to help men and women across the country for all their difficulties, questions, and how to have correct approach to management of COVID in these difficult times. I would like to start by reiterating Dr. Srinidhi's same statement that I hope all of you and your family are safe out there. We understand the anxiety and concern in young women, both pregnant, planning pregnancy, or maybe suffering from any gynecological problem today, that what's going to happen? Again, if I get infected, if my partner gets infected, what will happen to my baby? Where will I deliver? Asked so many questions. In fact, I remember one of my students called me one day and said, ma'am, I'm 36 weeks pregnant and I I'm worried my husband is doing COVID duty. What will happen? I'm happy to receive a message 3 days back, ma'am, I delivered a boy. So things go well. So one must remember, as a pregnant patient, you are no more challenged or more having a chance to get infected as an average man and women. So we at Apollo, not just by these series of programs, but all of us as healthcare workers are behind you with updated knowledge, with evidence-based medicine to make sure your journey of motherhood or your problem solving of gynecological issues goes smoothly according to your choice and makes you happy in the end. And that's what the Obstetrics and Gynecology department at Apollo across the country is all about. So stay home. That's the first thing which I would like to say to all those women who are pregnant or planning a pregnancy. The government orders are also so right now with the lockdown. So maybe even if the lockdown goes up, please try to stay home as much as possible. Try to do your work from home if you're an employed person. Step out only if you are in the essential service, like many of our nurses or doctors or any other essential service walk out of their door, pregnant or not pregnant, taking care of others. But remember that you must have your protection on, because if you fall sick, who's going to take care of the rest of you? So mask, maintain your distance, and make sure you do not touch your eyes and nose with your hands unless they are washed, and if water is not available, properly with a sterilizer. You can step out to do your day-to-day activity, maybe a short walk, maybe even go for an essential food shopping. But believe me, today online e-commerce is really on the top in this country. Whether it is for your food or your vegetables or fruits, or even for that little baby shopping that you want to do for your little one, do it online. You have so much choice. You can make those choices today and make sure that your journey becomes you very, very happy. Remember to maintain distance from people around you, especially ones if they're showing symptoms. Avoid crowded places. Don't go for a get together or a party just because you felt that I needed to go. Don't. Nobody's going to mind right now. You need to remain safe and happy. The other thing, if you're pregnant, remember that you should not miss your antenatal appointments. I absolutely understand the concern in stepping out of your home. You think if I go to hospital, I may catch an infection. Well, that concern is not unfounded. Yes, if you're out of home, if you're in the middle of other people, there is a chance, but not if you take proper precautions. And we at Apollo, or most of the hospitals who are dealing with maternity services, we take a step forward, an extra step to make sure that we maintain the proper environment so that we can cut down your horizontal risk. That means person-to-person risk as much as possible. Not keeping your appointments may harm you or your baby in the long run. So make sure you have those appointments. If you are really unable to walk out of your home, please connect with your gynecologists and obstetricians. Today, we have telemedicine services. We have Apollo 24/7 at our Apollo group, which I am telling you is a boon today. I am absolutely enjoying talking to my patients today across that platform because, as I say to my patients, I can smile at you and you can smile at me, which is not possible in my office anymore because we are behind a mask and you are behind a mask. So please use these opportunities. World is changing, change and make sure you make the right choices for your safety, especially if you have any underlying problem and you're pregnant. For example, you may be having diabetes and you are pregnant. Make sure you don't miss your appointments. You monitor your sugars very well. Make sure you can take a consultation or opinion at the right time and safeguard your and your baby's health. If by chance you are pregnant and develop symptoms, first isolate yourself. Call your obstetrician, call a physician, make an online appointment, understand what you need to do. It is likely that it will just be like a flu and it will pass over in a few days' time. But it's important to know that you are coronavirus infected patient and take the appropriate care that you need to take. As I said, we at Apollo are trying our best to make your journey from antenatal to the time when you deliver, our labor room, our staff at the point where you need to do your intrapartum care, to your postpartum care is ready to take care of you. Although, let me be honest, we may be a little challenged as far as the healthcare worker availability, and this may be possible. So I'd request, bear with us, help us, stand by us and walk with us. so that we can be able to do the best for you. We reassure that pregnant women, as such, from what information we have, are not at extreme high risk. So don't panic. You are just like any other person in this environment and in this population. I reassure you the best care from our medical services team at Apollo Hospital to take care of you. So I think I'll end here and we'll see if there are any specific questions which all of you would like to know from us. Thank you.
Thank you so much, Doctor. So you were talking about pregnant women. Are they more prone to getting COVID-19, you think?
No, not by being the virtue of women or by being the virtue of pregnancy. They are not. They have the same chance of acquiring a respiratory infection, which is the COVID-19 is, if they are in contact with people who have the infection, if they don't wear a mask when they're in contact with people, or if they have family members who are positive and they did not take care, or they have gone to a crowded place. So I think there is no extra, but if you're pregnant, remember, you need to take extra care. If I am a regular person, if I take 50% care as a pregnant patient, I'll take 90% care that I don't get the infection. Try to avoid it.
So are the symptoms of COVID-19 different in pregnant women, or it's just as anybody else?
No, the symptoms are very similar. And in fact, almost 80% of pregnant women who developed COVID-19 infection just pass it on like a flu. So they do not develop any problem, especially in the early part of pregnancy. The problem can occur in women when they are in the later part of their pregnancy. So that means especially in the third trimester. If you develop a severe infection in the third trimester, there is a high likelihood chance that you may develop more respiratory distress requiring oxygen supplementation, and in a very small percentage of patients requiring an ICU admission with ventilation. And as you may understand, that when you are in the second half of the pregnancy or the later half of the pregnancy, you have a large belly that itself presses onto your diaphragm. So the lung expansion as it is little compromised in a pregnant patient. And on top of it, if you develop a respiratory infection, it might be a little bit more difficult to manage. So the second half pregnancy, as far as the COVID infection is concerned, you need to be a little bit more careful.
But what about the complications of COVID-19 that we hear about, as in terms of extensive pneumonia or blood clotting, or even heart myocarditis, or the cytokine storm? So is it known that pregnant women are more susceptible to these? Do they have a hypercoagulable state, for example, or is it the same as anyone else?
No, it's not a myth. The second half of the pregnancy, as you rightly said, is pregnancy itself is a hypercoagulable state. Now, pregnancy has higher chance of developing blood clots, deep vein thrombosis, or even cerebral sinus thrombosis. These are known problems in an average women that can take place. COVID-19 infection, by the virtue of that infection, has higher chance of clot formation. So there is a possibility that your risk may get multiplied if you are, especially in the later part of pregnancy, and develop. So yes, in a way, there is truth in that. However, let me reassure that most of you will not face that. So if you get infection, don't panic. Try not to get the infection, first of all. But if you don't panic, take the right advice at the right time and take the right medication and the treatment suggested to you.
And I think one important thing to remember is, I think when they have an infection, the best thing would be for them to contact their obstetrician, who will surely guide them instead of listening to a lot of advice from many people, which confuses and panics people more than anything else.
I agree with you, Dr. Sinha. Absolutely. In fact, there are so many people giving so many advices that at the end, you don't know what is right and what is wrong. So perfect. If you're pregnant, talk to your gynecologist and the obstetrician first. If she feels that, yes, you are in a situation where she herself can guide you and manage you, fine. If she feels you need a specialist's opinion or some advice in terms of intensivist or a physician, please feel free, ask her for the right person. And as I said, most often you need to monitor yourself and tell your condition. And the person across the screen can tell you what to do, unless they ask you to walk into the hospital and they are not sure what's going on. So all you need to do is make sure that you record your temperature, and understand that you're not running fever incessantly and not coming down by medication. The second is, how is your respiration? So for respiration, we need three things. We need to do a respiratory count. That means count how many times you're breathing every minute. And in pregnancy, as it is, there is a hyperventilation. So we may get confused. The second is if you can have a small pulse oximeter, record your oxygen saturation. And the third, actually not many doctors advise and not many patients do, is a 6-minute walk test. So all you need to do is record your pulse oximeter. See, say supposing you're 96 or 97, just walk at your room or in your apartment or your home for 6 minutes at your own pace, and then record what is the drop. If the drop is significant, probably you are heading towards some kind of pulmonary complication. And being pregnant, you must approach doctors earlier than later.
What about a COVID-19 patient, doctor, who has discovered during her infection that she is pregnant, test positive for pregnancy as well? So is there a reason to discontinue the pregnancy, or is it safe to continue?
I know. I will actually answer these questions in 2 parts, which I've had recently conversations with some of my patients in the same manner. We've had some friends and patients who just called me and said, I was wanting a pregnancy, and fortunately or unfortunately, I had a COVID positivity and a pregnancy positivity. What do I do? Well, for them, it's a good and bad news together. But what we understand is we don't know whether this virus is teratogenic. That means whether it will cause abnormality in the baby's development, like some of the viral infections is. If you want, I can tell, say, rubella. If you get rubella infection during your pregnancy, it might cause abnormality in a baby. But this virus, we don't know. If you compare with an average flu virus, which is also corona, something similar, maybe we don't know. So as of now, as gynecologists, we are not recommending termination of pregnancy if you test corona and pregnancy positive almost together. We trust the system, we trust the God, and we trust the system that what information we know as of now is not going to harm. But nobody can say for certain. The second situation sometimes that happens is that somebody was positive with corona or COVID and was taking medication. And as Dr. Srinathi said, many times there is a cocktail of medications which is being given to the patients without, they just hear from here, there, someone doctor says, and like they take a cocktail and too many medications. And then towards the end of it, they suddenly find that, oh, I missed my period as well. So they not only just have the COVID infection, but they've also exposed themselves to a lot of medication, which is always a concern. So in that also, we need to see 2 things. One is, what are the medications? If the medications were otherwise safe or ones that we once in a while do use in pregnancy, we could ask them to continue. The second important thing for people to remember and not panic is if you have taken your medication before you actually missed your cycle. For example, you had, say, supposing you had your period on 1st of April and 1st of May, you did not get your cycle and you found that you were pregnant. But you took the medication in the second half of April. So you took the medication before you actually missed your period. That's the time which we call as an all or none phenomenon. Unlikely that those medications will have had effect on your pregnancy. Wait and watch and see what happens. So these are very tricky situations, and many women panic because of this.
Also, in the same way, if somebody is undergoing infertility treatments, for example, if they're going through many cycles of IVF or IUI, should they kind of put it all off but is the pandemic ever going to end? We are not sure, but is it advisable to actually go in for assisted pregnancy at this time?
I'm sure you can, because there is no evidence as of now that coronavirus, if infected, will reduce your fertility or cause any problem. So again, as I said, if you're not yet infected, please go ahead with your fertility treatment, because how long will you wait? It's already been more than a year. We have actually been really talking and postponing patients' problems for so many years, 1 year more or less. So I would suggest that please go ahead, take all the safety precautions. Your IVF center, your reproductive doctor will take care, and don't delay it. There's no reason. However, if you get an opportunity, vaccinate yourself.
That's the other, a lot of rumors and vaccine hesitancy is there in certain states over the others. There is a lot of hearsay that, it interferes with people's menstrual cycles and fertility. That's one of the common reasons for vaccine hesitancy, at least here in Tamil Nadu. So could you also put us right on that?
It's a myth that coronavirus vaccination will cause any interference with your menstrual cycle. there is no evidence to that. So you don't have to wait for your cycle to get over or understand which day of your cycle you are to be able to schedule your vaccination. In fact, at the moment with vaccination, we are like beggars. You get it, you take it. Don't wait for too many pros and cons that I'll schedule this day or that day. Please take whichever day you are available. So there's no problem at all as far as the menstrual cycle is concerned. People may correlate a lot of abnormality in their menstrual cycle with so-called vaccination that they took. But believe me, with this stress, lack of physical activity, the change in the whole lifestyle, this is another very common problem that women connect with us, that they are getting delayed cycles, irregular cycles, and we know that a simple mental and physical stress itself can cause this problem. Unfortunately, it gets correlated or kind of coinciding with you took a vaccine, and then everybody says, oh, vaccine caused this problem, but not so. So there is no recommendation to not take vaccination. You can take vaccinations in any part of your menstrual cycle, no problem.
This is another common question, whether the COVID virus actually crosses the placenta, and is there any chance of the baby also? At what point of time does the baby get infected?
Okay. As of now, we have no information or no evidence to say that coronavirus crosses placenta. This is called a vertical transmission. So if there is something that can get transferred from the mother's system or blood into the baby, is called a vertical transmission. There is no evidence to say that there is any vertical transmission that's taking place. So that's point number one. The point number two is that people may be worried, or women or mothers may be worried, that I may transmit the infection at that time of birth. Okay. Again, we have not found evidence that there is so much of infection or coronavirus in the vaginal fluid, okay, at the time of delivery, because that's what the baby comes in contact with. So that transmission is also not very evident. We don't have evidence of that. However, once the baby is born, then how the baby is handled, if the mother was positive or any other family member who was positive handling the baby, will make a difference to the baby's infective state, just like anybody else. So if I'm asymptomatic carrier or infected and I hold a newborn baby without proper precaution, I may transfer the infection to the baby.
So is it necessary that all, as soon as baby is born, irrespective of the mother's COVID status, assuming she may be asymptomatic, what precautions need to be taken?
Today, Dr. Nidhi, most of the mothers who are coming for confinement, that means coming for hospital delivery, are getting tested whether they are positive or not, because that's a general recommendation we are following. So if we know the status that it's negative, okay, we can think that there could be a false positive or negative status here. About 20% patient, in spite of being positive, can have a negative report. So it's a good idea to at least do a barrier. That means in terms of wear a mask when you're close to the baby. And once the mother and baby go home, say 5 or 6 days or 1 week later, if there is no symptom developing, nothing is happening, where everybody is sure that there is no infection, then you can be absolutely sure. But in the hospital setting, it might be a good idea to at least wear a mask while handling the baby, just because the other healthcare workers are doing the same. So even the mother can, if possible, maybe a practical idea there.
What about breastfeeding, doctor? If a mother is COVID positive, is it a good idea to breastfeed the baby or not?
Okay. One thing is sure, that the baby should get the breast milk. The milk does not have coronavirus. So if the mother can express and give it to another family member to feed the baby, would be ideal if she is positive and in the infective state. But if that is not possible, then again, as I said, the mother can wear proper N95 or proper mask, wash hands very well, keep the baby on the breast, feed, and then take away. So the minimum contact, feed the baby and take it away. So it's important to give the breast milk. There is no reason why breast milk should not be given to the baby, or baby could be denied for breast milk just because the mother was COVID positive. But adequate, as we say, COVID appropriate behavior has to be instituted there.
What about, the antenatal care? You just told us that it is very important for the mother not to miss the appointments. Is it okay to just do it on video consultation, or but will that actually, how will the fetal heart rate and other things be measured, or they have to go to the hospital?
I understand this is could be a very, very genuine concern and question from women. Having said that, in this coronavirus pandemic, we are also rethinking which are the visits we could do this way, like an online, and which are the visits we really want the patients to come in. So there are some visits the patients needs to come in. Like in the initial, supposing when you are just diagnosed or you just found that you are pregnant, you need to come once to the hospital to at least get a scan done, confirm the gestation viability, do some basic initial blood tests, have one evaluation with the doctors, know your weight, blood pressure, a basic that may be necessary. Following that, there are 4 or 5 times when they need to come in. Then they need to come in at the time of their 3rd month to do an NT scan. That can get combined with a physical visit to the doctor as well. Then they can come back at around 18th or 20th week, where again a scan is required, blood test required, a sugar test. So we could modify, actually we are modifying to reduce the number of your visit to a hospital. So, but making sure that we are not missing out in your adequate antenatal care. So I wouldn't say either is true. That means neither can I say that all the visits on the video will be sufficient. Or I would say that you need to come every 2 weeks or every 1 week to see the doctor, not necessary. So we could walk a mid path here.
Right.
And your obstetrician will be the best person to judge, because she will know your background and she will understand how frequently it is essential to see you in the physical form.
Coming to, again, a COVID-19 infected mother, is there any, what kind of delivery is prescribed? Should they go in for a cesarean, or is a normal vaginal delivery allowed? And if so, are there any specific ways in which the labor is managed?
Okay. The labor is no different in a COVID-19 positive patient when compared to any other mother. So we do not suggest or take any decision of a cesarean section just because a woman was COVID positive. So that's not true, and that should not be done. If you are COVID positive, you can very well undergo a vaginal delivery. However, you have to understand few things. In vaginal delivery, the delivery is little long. You may require pain management. You may have a long, prolonged second stage where a lot of exertion is required. You may require help at that time. So if you are COVID-19 positive, but asymptomatic and perfectly in otherwise good shape, you very well can undergo a vaginal delivery. But if you're already a compromised COVID-19 patient, who is already lung-wise compromised, may not be able to take that strain of delivery, we may decide because of your COVID status to do a cesarean section, but not for any other reason. So decision for cesarean section in a COVID-19 patient is taken for obstetric reason, not for COVID-19 positivity. You can very well undergo. All we would suggest that the other thing that pregnant women, both antenatal and intrapartum, feel these days that they don't have all the loved ones around them. They are used to having mother-in-law, maybe a sister, maybe somebody else. 4 or 5 people would actually accompany. That's our culture. To a pregnant woman to the hospital, or maybe at the time of a delivery. Today, we request have one person. So you may have to take that call today and understand that if I go into labor, who will my partner be? Will it be my husband or my mother or my mother-in-law or my sister? So we are trying to restrict for your safety that less number of people walk in with you. So that's another thing which you need to remember and plan ahead of how you would take care.
Here are some questions about COVID-19 vaccination. So the first one is, supposing somebody is planning a baby, trying to get pregnant, now should the vaccine schedule be taken into account? Like, for instance, they should finish their vaccination and then do it. I mean, if they get pregnant, we already discussed, but if they are actually now trying for a baby, should it be postponed till they finish their vaccine?
Dr. Srinidhi, I think it's $1 million question. We don't have answers, but I will give you what I personally feel logically. However, said that we have these vaccinations, they are safe, all of us are taking. But we still do not have long-term data to say that if somebody took it during pregnancy or in their first trimester, that means the first 3 months, which is the most vital time in pregnancy, what was the outcome 20 years later? We don't know. Obviously, the disease is not that old either. So I would suggest that if you are pregnant and at a place where you think you will get COVID-19 infections, better to take vaccine and save yourself rather than get the infection. No two thoughts about that. But if you're planning a pregnancy and you have a chance now, almost 18 years and older have got an option to take the vaccine, I would suggest that if you have waited so long, maybe wait a month or so, finish your vaccination and then start. Because it is possible that if you take first vaccination and then you are trying for pregnancy, you may get pregnant. And then your second dose comes in your first trimester. Although if you look at the data here and there, nobody's clearly saying what exactly will happen in the first trimester.
Not enough. We've just started, so we don't know.
True. So this is my logic. I mean, that's my very practical thought over so many years of experience. I feel that if you have waited so long, finish both the doses and take it. That might be correct, because we also don't have, we actually, if you look at the vaccination and the pregnancy status, we have long-term data, large data, not long-term, large data of the mRNA vaccines that are available in the United States right now. So they have about 90,000, 1 lakh pregnant women taking, and in the short span that they have studied, there has not been any problem. But we don't have correct data regarding the vaccinations that are clearly available in our country. Yeah. The AstraZeneca Covishield still has some data from UK, but not a long-term data either. So although all bodies, all international recommendations are that pregnant women should not be denied of vaccination, we have to understand what we are doing here. So first trimester, try to avoid. Second, third trimester, I think should be safe.
And is there any particular choice of vaccines? Of course, we don't have the mRNA vaccines. Given the choice between what we have here, what should a person who is pregnant or planning to get pregnant?
I don't have scientific data to give you this answer. So because most of the 2 vaccines that are available here, the third one has just come, we just have data of their safety profile in a regular population. We don't have information about their safety profile in pregnant women. So
guidelines, doctor, I mean, are pregnant women, are they taking the vaccine or?
Yes, yeah. They are. As far as the United States is concerned, the mRNA vaccines is being routinely given to pregnant patients. The UK, the Council for Immunization and Virology, the Joint Commission, has given permission for of course, these mRNA vaccine plus the Covishield, which is available at our country, to be given to pregnant women in UK. So that recommendation has been given by international bodies, and pregnant women are taking these vaccines.
There is, I'm just going to see about our questions. What about other procedures? Like now we've spoken about pregnancy and labor. There's also, but before that, I'd like to ask you one question about oral contraception in view of the COVID-19 also causing, like some people do get into hypercoagulation, and so do people. There's even some talk about vaccines producing clots, and we know that oral contraceptives also have that side effect. So should people move into other types of contraception, or these are okay?
If you ask a logical, practical answer, well, there could be a correlation. Again, there is no long-term study to tell me that people who developed COVID infection and were on contraceptive pills developed clots. So there is a direct correlation. We don't have scientific evidence for that. However, what you have said is correct. Coronavirus infection has a chance of developing clots. People on oral contraceptive pills, not all, but people who have a tendency to develop, either has a family or a personal history of developing deep vein thrombosis, can develop clots. So these are true. Yes, we have some evidence or some reports of people developing clots following vaccination. Still, the last word has not been said on that aspect. And the general recommendation still is that it's such a minuscule risk that it is better to take the vaccine and prevent COVID infection rather than worry about that very, very little percentage of risk of developing a clot. So there is really no recommendation as of now that women should not take contraceptive pills or even take any kind of hormones. Because as I said, a lot of women are on hormones right now for their bleeding disorders, for their delayed periods, for their so many things. Because all those gynecological problems are just being moved into the back seat. And women are just managing their problems by taking hormones or this and that. So every second patient that I consult is on hormones at the moment, if they are having some bleeding issues. So these are very practical things which we need to understand. There's no hard and fast recommendation that I would say just go off these medications. I don't know. We don't have that answer right now.
So talking about people who have gynecological disorders like irregular cycles or heavy bleeding, they may be due for even a hysterectomy. So do all these procedures also need to wait, or do they need to, is it safe for them to plan these things? Or what if they test positive just before the hysterectomy? Obviously, the surgery will not happen immediately, but what is the way forward for people with gynec disorders?
Okay, so gynec disorders, when the pandemic is really in the upswing, that means that the infections are really very high, there is a general recommendation, and the general logical thought is that if elective surgery can be postponed, it should be postponed for various reasons. Number one, for the safety of the patient, to reduce the exposure of that patient to coming to hospital and things like that. Third is to prevent or maybe utilize your hospital resources better for the COVID patients right now rather than for patients who could postpone their surgeries for some time. Having said that, this pandemic is going on for more than a year now, and we cannot be postponing women's problem who require a surgical intervention for too long. But what women need to understand that if they have to plan, they need to find their window, they need to find their space where they could schedule their surgeries and go ahead with a safe surgery. The only rider here is that in case you are planning a surgery and you can get a vaccination, please go ahead and get vaccination done and then come for surgery. That's the safest you could do. The second, if you have had a COVID infection in the last few weeks, we know there's a very large multi-center, multi-country trial which has just been published last month, which shows that within the 6 weeks of your developing infection, you have a higher chance of developing post-operative problems. So if you developed a COVID infection and you were scheduled for a surgery, wait for at least 6 weeks before you plan your surgery. That I'm sure your surgeon also will guide you. So these are the two things which I would say. If you really need a surgery that is being postponed and your health is at stake, go ahead, plan the surgery and get better in your life. Take a vaccine. If it's possible, then come for surgery. If you had a COVID infection, wait for at least 4 to 6 weeks before you plan the surgery.
What about the annual health checkup that, many people do it every year, where there are certain gynecological tests also done, like maybe a pap smear or even a mammogram or an ultrasound. Now, many people now say that we can do it later, but then invariably within 2 months, there's something else. And then again, there is a rise in cases. So how safe is it to really go for just a preventive health checkup now?
I'm glad you asked this question, because I feel that, especially if you talk in this forum where we are talking about women's health, annual checkup, I'm mainly concerned regarding the pre-cancerous conditions that we diagnose. Because I know that in case we diagnose these pre-cancerous conditions or even the cancers in early stage, many of these cancers are completely curable. It's a pity that because we did not come down for an evaluation or an annual checkup, we developed these problems. Having said that, I understand the concern in the minds of patients. As you and I know that the health check departments in hospitals like Apollo or any other hospitals is an entirely different fold. They are maintained in a different sterility. We take care of patients in a different way because we understand that they are not patients. They are actually normal people walking in to understand their health. So we have more responsibility to them than the regular patients, because patients already have a problem. We can't give them a problem. So we take adequate care. It is advisable that you remember to have some kind of checkup. And in women, especially breast cancer, cervical cancer, endometrial cancer, they all can be diagnosed early and completely cured. If you still think that, yes, I will wait 1 more year before I go, I would like you to be smart. Why? Because you can do, at least for the breast, you can do a self-breast examination. Make sure you're not missing something which is, on your face. The second is, if you're having some abnormal discharge or abnormal bleeding or postcoital bleeding and something, that can be sign of an abnormal cervical problem. All you need to do is walk into a gynecologist office. It takes 5 minutes to do a pap smear and walk out. Or your grandmother or mother who is postmenopausal and is having bleeding. It is important that a postmenopausal bleeding does not go unnoticed. Maybe 80-90% will come out to be non-cancerous, but those 10% to 15% who is a sign of cancer could be completely cured by just hysterectomy in this stage. But if it goes late, then you have endometrial cancer, which is spread, and you have a more problem at hand. So annual checkups definitely have their role. I would maybe encourage all of you that if you missed your last year, somehow this year, don't miss it again. Make sure you walk into the office and get your annual checkup done.
Thank you, Doctor. So now we will take a few questions that are coming to us from our FB Live audience. The first one is, after 2 doses of vaccination, when can we plan for pregnancy? But we already discussed that.
Yes. You can plan anytime. There's no reason to wait for too long after the second dose.
Can a woman who's breastfeeding take the vaccine?
Perfectly. Yes, absolutely. No reason for not taking it.
In a marriage of 100 people attending, what precautions should a pregnant woman take?
Don't go. Seriously, I'm seriously. 100 people are too many people right now. Don't go in a crowd, in a place where 100 people have collected. Because whatever you do, I think it is extremely difficult for people to be in a mask for 3 hours. As I always laugh and tell my friends and patients, see, we are used to wearing masks. We wear masks even before Corona, 5-6 hours, we are in mask, we are operating, we don't even realize we are in a mask. So today somebody tells me, don't touch your mask for 6 hours, I can manage, but not you. And I've seen this, the minute you want to speak, you want to pull it out and speak and then put it up. So, this is the most dangerous. Your hands are not clean, you're touching your mask is the dangerous part. Yeah. So I'd say don't go.
Family photographs, they want to take off their mask. But that also holds good, no, doctor, for pregnant women, because in our country, we have all those rituals. And so people feel that, they need to do it. And then it becomes like calling people. So perhaps they also should be looked at a little more carefully and avoid all those crowds.
Get your closest people, maybe 3 or 4, and ask the rest to join on Zoom.
Yeah.
It's an unusual. You'll remember all your life that this ceremony happened on Zoom. It will be a different memory for your lifetime and to tell your grandchildren.
The other questions are again only about vaccination gap. Should there be a gap between vaccination and conception, which we have?
I don't have any scientific evidence to wait. So once you have completed both the doses, we understand that in terms of your protection from coronavirus, you need 2 to 3 weeks post your second dose. So that then you are absolutely protected. But other than there should not be any problem in your getting pregnant or continuing with the pregnancy because you had 2 weeks back or 1 week back your second dose. I see no scientific evidence there.
Doctor, finally, I wanted to ask you about the emotional and mental health of our expecting mothers, because there is already a lot of hormonal surges and there is already so much of anxiety. So what would you advise them? What would you tell them to, because they do say that you do need to be calm and relaxed. So how can they be like that at this tough time?
I know. I think you have brought out the most important aspect of the whole discussion today right now. As I said in the beginning, that we understand your anxiety and concern. But remember that you being pregnant are at no way higher risk in catching the infection, number one, as anybody else. So the first thing that, other than getting worried and anxious, is to pay attention what you can do to prevent the infection. And I think we have all been talking for the last 1 year about what few things we have to do. It's not rocket science. It's very simple. You need to wear a mask. You need to maintain distance. You need to wash your hand. You need to minimize the number of people you come in contact with, especially people whose status you're not sharing. So I think it is important to remain positive. Focus your energies in what you can do rather than what you cannot do. As it is, concern, anxiety, even if without a corona time, it is absolutely normal for a mother, because you may think, oh, what will happen in my delivery, whether I'll have a good child or not, what if I have a daughter, what will happen, if I have a son, what will happen. The things are innumerous. And if you're a mother, if you look back 3 years behind and you'll say, oh my God, why was I even worried about it? It didn't make any difference. So I think we will go with the Shakespeare's line that this too shall pass. Remain positive. Focus on what you can do rather than what is not in your hand. Be smart. Be ready to pick up the clues that something is going wrong around me. And if it is possible, if others are not isolating, you isolate yourself and make sure I'm not going in contact. Because sometimes women in many situations don't have control. They may tell two members of their family that I think you have infection, you go into that room. They may not. Okay, I'll go into my room. Be smart. That's what I try to tell you. And be in touch with the healthcare people. And today you can be in touch with, in a closed door, with your mobile phone, with anybody. Take that opportunity. As I said, be smart, be happy.
Absolutely. On that very nice note, we will conclude this session. Thank you so much, Dr. Sinha, Dr. Rooma Sinha, for this really wonderful discussion. I'm sure many people have watched it and have learned a lot. And I'm sure they go through their pregnancy in a much more relaxed and confident way. Tomorrow, we have a discussion on muscle aches or joint pain during COVID-19. And this is going to be discussed by Dr. K.P. Kosigan, Apollo Hospitals, Chennai. Meanwhile, till I see you tomorrow, take care, be safe, and don't forget SMS, which is the social distancing, wearing the mask, and sanitizing properly all the time, making sure that your hands are sanitized with either soap and water or with sanitizer. Take care, be well, be safe. Namaste.